Welcome everyone, and thank you for joining us for the second session of the series Planning for Success with Chronic Condition Management. My name is Natalie and I'm from the PHN Education team, and I'm joined today by Sarah Houlihan, who's the Primary Care Practice Liaison Officer and Primary Care Practice Nurse. Before we begin, I would like to acknowledge the traditional custodians of the land in which we live and work on. For myself, on the Central Coast, that is Darkinjung country, I'd also like to pay respects to elders past, present and emerging. Just a couple of things to let you know for this session. This will be recorded and available for you to view in our education library, along with a copy of our presentation slides in a few days. As attendees, your cameras and microphones are automatically disabled. If you do have questions during the presentation, however, send them through via the chat box, which you'll find located in the control panel. These will be answered at the end of the presentation. Please keep your mics and cameras disabled through the session. An evaluation will come to you directly after the session. Your feedback's extremely important as it enables us for future education sessions. Now, it's my great pleasure to introduce Sarah Houlihan.
Thanks, Natalie. Welcome, everyone. As Nat said, this is the second session of our 8-part series regarding the upcoming changes to chronic condition management. My role is a practice support officer with PHN, and my background is practice nursing. I'm also coming from Darkinjung land on the Central Coast and would like to pay my respects to any First Nations colleagues who are joining us today. So as I said in the last session, I want this series to be driven by you. So the questions that are coming up in your workplace, any ideas, your sticky points. If you've got any questions today, please do pop them in the chat and we'll endeavour to answer them at the end of the short presentation. And if we can't answer them today, I will find the answers and get back to you. So as a quick reminder of why we're here and why things are changing from chronic disease management to chronic condition management in July. You'll see there the department are wanting to simplify and streamline arrangements, promote the continuity of care with regular providers, and as well as ensure that patients are continuing to get the access to care that they need. So we know from statistics that approximately 60% of our Australian population live with a chronic condition, at least one chronic condition. However, only around 20% of the population have got a care plan in place. And then for those who do have a care plan, reviews historically have not been used well. So we can see that, you know, their data is there to support a change and why we need to be doing more regular reviews because not doing the reviews, of course, impacts the effectiveness of the care planning process in terms of improving patient quality of life, including addressing potentially preventable hospitalizations. So last month we talked about having the communication with your team. For those playing along at home who've done your homework, hopefully you've now had that discussion with your team and talked about what changes you might be thinking about making over the next few months, ready for the changes coming up in July. You might have looked at whether you need to begin recruitment shortly to be able to offer more review appointments. But this month we are here to talk about communication with patients. Now, again, this month we are still waiting for legislation to pass. So the disclaimer does still remain that things could change. But what I share with you is what we are getting as a PHN fed through the National PHN Collaborative directly from Department of Health. So the main changes, of course, coming in July, they're around more streamlined referrals, you know, ditching those complex 723, the team care arrangement back and forth, and just moving to a simple referral process between doctors and allied health like any other referral. Of course, that has no effect on patients at all. And then the other major changes around the billing item numbers being streamlined across the year rather than having a more incentive to do new plans as opposed to reviewing existing plans. So again, that shouldn't affect patients at all. What might change for them though, and this will of course depend on how you currently do your care plan reviews in your practice, might be around the frequency of visits for patients. You know, we want to prepare, if we're going to be changing the way that we're doing reviews of our care plans, obviously giving them a heads up, we're going to be seeing you more often. And this is a good thing. We know that you want to be well. We know you don't want to be in hospital. We are going to be taking a more proactive approach to managing the chronic conditions that you live with. And of course, more reviews means more appointments. We know our doctors in most cases are already at capacity. So this is where we start really looking at, are we properly utilising our nurses and our Aboriginal health practitioners, Aboriginal health workers, as that we take a team approach. It's not just on GPs to be doing the care plan reviews. So if you aren't already providing a multidisciplinary approach for patients, this might mean that from July or leading up to, that there's some new faces for them. And this might be part of your communication plan. So as we touched on last time, there are no expected changes to the number of subsidised allied health referrals or the nurse support sessions. Again, obviously, if that changes, we will let you know. So My Medicare remains a voluntary program for patients, providers and practices. And the Department of Health communications are clear. The care planning services will continue to be available to all eligible patients and their GPs, regardless of My Medicare registration. However, patients who are registered for My Medicare will only be able to access chronic condition management items by their regular GP who they are My Medicare registered with. We know, obviously, your practice is probably doing it too. There's lots of encouragement out there for patients to register for My Medicare whenever they book an appointment with a practice. So it might be something for you to think about, are we communicating with our patients so that they understand that if they do register somewhere else, they're welcome to do that, but that is going to cancel their registration with us. So letting them know that so that they can make an informed decision if they are invited to register with another provider. Because what we don't want is for, obviously, your regular patients who you would like to do chronic condition management plans with to not be able to access that because they're registered elsewhere. So for this month, my suggestions to you would be work with your team to develop a communication plan so that you've got a consistent message for everyone. We don't want patients to feel concerned that they're going to be losing anything. We don't want any misinformation getting out there. So just giving them the facts that this is what we know so far. There are changes coming. Most of it is actually going to affect us. The changes that might affect you as a patient are good ones. You may start to look at implicating more regular care plan reviews now. So we notice, obviously, looking at the data, that there's definitely an opportunity for the vast majority of practices to be doing more care plan reviews. If you look at your data dashboard provided by the practice support team, you'll be able to see that that gives you an idea of the number of reviews versus initial plans that are being done. If you don't have a copy of your dashboard or you would like one, reach out to the practice support team. We'd be happy to go through it with you. And then, of course, the other suggestion, which will stick here every month, if you're not already registered for My Medicare and you would like to be, now would be a great time to do it. Now, if there are any questions that you've got burning today, I'd encourage you to pop them into the chat, as I said before. Happy to have a look at those in a minute. What we do have, though, are some questions that came through from the last session in the evaluation. So thank you very much to those people who did fill out the evaluation and send through their questions. So there were two main themes that came from the questions after the first session. The first one being around what should be in a care plan. Should one care plan cover all chronic conditions? Should patients have multiple care plans? That sort of thing. So this is a nice, easy one to get going, and I appreciate that. Happy to discuss it because I'm confident there's not going to be changes to the basic premise of what a care plan should entail. So the straightforward answer to this question is yes. A care plan is the patient's plan of care. Whether it's currently in its current state under chronic disease management or from July under chronic condition management, it should always be about the whole patient. It should include the planned care for all conditions and the treatment for each of those conditions because it's a picture of everything that the patient needs. Understanding that will help you if you're a manager or a nurse team leader or a doctor, business owner, will help you to understand what's actually involved to make sure that we're allocating appropriate time for the plans to be generated, but also reviewed so that these are meaningful plans for our patients. This is not a paperwork process, although there is paperwork involved. We want this to be us actually addressing the chronic conditions of our patients, monitoring their progress, setting patient goals, and anything else that might come into the item descriptor once we get to view that later in the year. And of course, understanding what's in the care plans also helps us to understand why, in addition to the allowance in the MBS for nurses and Aboriginal health practitioners, Aboriginal health workers to assist GPs with their care plans, that the government also provides the workforce incentive payment as an incentive for practices to employ nurses and other qualified professionals to assist with these tasks, because they're just, if it's done well, it's too time consuming and not cost effective for GPs to be doing themselves. And then the other question that we had, or along the themes of, was around timelines for billing and referrals. Now, obviously that was at the start of February that we presented that, so that was on a lot of people's minds having come into the new calendar year. Now, I won't go into this too much because we don't know if there might be any changes in July. However, as it stands for this year, and at least until the 30th of June, I guess the key points to get across to you, to your team, is that allied health referrals under the current team care arrangements do not expire. As long as they are still, the referral is still relevant to the patient's needs, the referrals remain current. If the patient was referred for 5 visits last year, they only used 2 of those visits, they still have 3 visits remaining this year. If they need more, once they've used those referrals, they can be referred for another, what was it, they've used 2, they've got 3 left over, so they could be referred for another 2, maximum of 5. It's never more or less than 5, it's always an availability of 5 subsidised allied visits per year. Now, how those referrals are done is up to your practice. If it happens to coincide with a care plan review or a nurse support and monitoring visit to organise that, or maybe just a GP consult, that's fine. There's nothing to say that it must be a 732 team care review to be able to generate the extra referrals. They are two associated but separate services, I guess, of chronic disease management as it is right now, and the multidisciplinary approach. Just making sure I haven't missed anything there. Oh, actually, yes, I will mention, so from the 1st of July, with the move to chronic condition management, the department have specified already that going forward, care plans will need to be reviewed at least every 18 months for allied health referrals to remain valid. But really, if we're being serious about quality care planning, we would hope that we're reviewing their patients much more frequently than 18 monthly anyway. But it is something just to keep in mind that while currently referrals don't expire, that is going to change slightly, but probably won't be an issue for majority of providers. Now, pop up the details for the next session. And Natalie, did we have any questions for today?
No, there's no questions in the chat yet, but if you do have any, just pop them in there and I'll flag them with Sarah.
No worries. So next month we'll come back together again. Hopefully legislation may have passed by then and we'll have a little bit more detail. But regardless of that, we're going to push on. We'll be looking at work smarter, not harder, considering our workflows so that we can get a really streamlined approach within practice to make it easy for your team and for your patients to be able to get the chronic condition management that they need when they need it. It's in that chat. Let's have a look. Oh, great. So Nat's put in the link to the evaluation. So yeah, if you could pop in there, and please do, I understand sometimes people don't want to ask questions in meetings. Please do pop your questions in the evaluation because just like today, we can go back and answer them when we're able to. If between now and next session you have any questions around chronic condition management, around the changes or anything else that we can help you with, please do reach out to our practice support team. You'll see the email address is there. We are here to help. Nat, I'll leave it with you.
Yeah, thank you everyone for attending the session. And as Sarah mentioned, just pop your evaluation in. It only takes a couple of minutes. And I just want to say thank you, Sarah, on behalf of everyone for providing this update. I know it's very important in review of the legislation changes happening shortly. Thanks, everybody.
Thank you.